First Mars check. 11/26/23, 1 o'clock. Patient Renee Adams, date of birth 5/25/1978. No known allergies. Formoteride, also known as Lasix, 20 milligrams IVP, Q12 hours PRN for weight gain greater than 3 pounds over 2 minutes with 3 milliliters of normal saline flush before and after. Patient has gained 4 pounds, therefore the medication can be given. So this is my first Mars check. I got formoteride, 10 milligrams per milliliter to equal 20 milligrams. The calculations times 3. I'm going to need 2 milliliters of this vial. But I have to check the integrity of it, which is good. The vial's good. The rubber's good. It's been opened 11/19/23, which means it's still in date. And the bottle's expiration date is 12/31. So this medication is good for use. Also, I need a solution before and after the medication. I have 2 10 milliliter syringes of normal saline. I'm going to be wasting 7 to equal to 3. That is ordered before and after. The expiration date is 6/25. The integrity of these 2 medications are good. The compatibility of all 3 of these medications is good with the medication patients already receiving. So I will gather my supplies. Upon gathering my supplies, I was able to pull a 4 for this video, 4 milliliter syringe. And I will trash clean for 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And I will trash. Keep aseptic technique. This is closed. I will use a 1-inch needle to make sure that we get a good seal, connect, and my medication syringe is ready. I will pull back to get the 2 milliliters of air to inject into the vial for the 2 milliliters. And I will clean for 15. You see that 15? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. On calculation, this is going to be administered 0.25 milliliters per 15 seconds. Again, I will pull the air back to 2, checking an eye level at 2. And I will inject the air into the vial as so. Nope. And I will pull, make sure the bevel is below the fluid level, pulling back to 2, and that there's no air in it. And there's no air, checking at eye level. Recap. Back in the drawer, and we will label this. 10 milligrams per 1 milliliter, 20 milligram Lasix, and there's 2 milliliters in here. So we will be giving this at 0.25 milliliters for the first 15 seconds. So there's my Lasix. I will throw this in the trash. Need 2 of these, 1 before, 1 after. I got my labels right here. The label on these will be 3 milliliters of normal saline flush before and after. So the labels have been done. So you're going to take the top off, and you're going to be wasting 7. at eye level. So I just want to make sure that this goes in. And this is supposed to be a proper container, maintaining aseptic technique down to 3. We got 3. So we just make sure all the air is out and cap. And we'll do this twice. There's the before. And 7 is wasted. Down to the 3. Make sure all the air is out at eye level. It's good. So we'll label this one 3 milliliters after. So now we'll do our second Mars check. We have flumaceride, 20 milligrams, flumaceride, 20 milligrams. We have 3 milliliters of normal saline flush before and 3 milliliters of normal saline flush after. So our medication is ready to go. And we will go and see our patient. This is trash. Make sure we have our sharps container and our stopwatch. Hello, my name is Sarah. Can you state your name for me? My name is Renee Adams. Date of birth. Can you give me your date of birth? 5/25/78. Are you allergic to anything? No, I am not. That matches my Mars. Can I see your armband? Sure, no problem. My armband matches my Mars for the verification of the patient. Now the medication is 20 milligrams of Lasix, 3 milliliters of flush before and 3 milliliters of flush after. So the medication is good. That matches with this patient. So we are good to go forward. Her PED has been elevated for safety. Lights have been turned on so they can adequately see. Check the environment to make sure all safety tubing and all of that has been and that it's not a concern. So I'm going to put my gloves on and I'm going to palpate the site, which is in the right forearm, and make sure that there is no infiltration or signs of infection on palpitation. And so I'm going to feel around the site, make sure there's no swelling, edema, or tenderness, no liquids draining anywhere, and everything looks good. So we will continue. And the first thing we're going to do is clean for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So that's been cleaned good. So we're going to connect our first one, making sure that it's adequately dried by air, which it has, before connecting. And I'll connect the first one. And the first thing we're going to do is we're going to aspirate, make sure we get blood and it's patent and it's good and the clamp's open and there's no intolerability. Patient's good. The patient's in the head of the bed's elevated where they can talk and have good conversation. So this goes into the waist. And then we're going to clean another 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. That's all been cleaned. So I'm going to remove my needle, throw it in the sharps container without contaminating anything, and connect my medicine. After the port has adequately dried, of course, and which it has. So I'm going to start pushing this over 2 minutes, which is 0.25 milliliters over 15 seconds, beginning in now. Should be getting close to the 1. Got 0.5 left. All right, I got 5. 15 left. 3, 4, and 5, and we're done. Alrighty, so patient tolerated well. We were watching the face and make sure there was no distress, and patient was tolerating it really good. So we're going to clean this again for 15. This flush is going to be given at the same rate as the medication, which is 0.25 milliliters over 15 seconds. So we just want to make sure we get this really good and clean for the 15 seconds. And it should be about now. So we will go ahead and do our last one. And patient's been doing good. Alrighty, so that went in nice and slow and good. I'll recheck my site, palpate, make sure there's no infiltration again or signs of infection. All looks good, so off comes my gloves and I clean my hands. I'm going to lower the bed, place the call light back in position, and make sure the patient has no questions or concern. There's no discomfort with the patient, and there's no signs of distress. And I will re-educate the patient on the importance of the use of the call light and letting us know when they had urinated or need to urinate and don't, so that we can document and make sure that there's no difference between that the fluid remains balanced and there's no overload in regards to that. So everything is safe. The room is safe. I will wash my hands and ask the patient if they want the door closed or open on the way out, and then go document.